Hi, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, so many of us enjoy getting outside and taking in that wonderful summer sun. But if you don't take proper precautions to protect yourself, you could be putting yourself at risk for skin cancer. Joining us today is Dr. Melanie Dixon. She is a family physician at Mayo Clinic Health System who focuses in skin care. Dr. Dixon, thank you for joining us on Speaking of Health.
Thank you very much. Very happy to be here.
Well, today we are talking about skin cancer and sun protection. First of all, how common of a problem is skin cancer?
It's a very common problem, and it's very important to have this conversation. There are 3.5 million cancers diagnosed annually and 2 million patients every year. 1 in 5 Americans will develop cancer in their lifetime. It's the most common form of cancer. If you look at breast, prostate, lung, and colon cancer, there are more skin cancers than all of those combined.
That's pretty amazing too, you know, because when people think of cancer, often they probably do think of a breast cancer or a lung cancer, something like that. Right. They don't think of skin cancer, but it is the most common cancer. That's pretty amazing.
Absolutely.
So what exactly is skin cancer?
Skin cancer, and really all cancers, are abnormal cell growths. When the skin is exposed to ultraviolet damage, it goes to the cellular level, it goes to the DNA, and when there's DNA damage, that can cause abnormal growth.
So are there certain types of skin cancer?
There are 3 most common types, the more common types: basal cell skin cancer, squamous cell skin cancer, and then the deadliest form, melanoma.
So of those 3 types, which is the most common?
Basal cell skin cancer is by far the most common. In the United States, every year there are approximately 2.8 million cancers, basal cell skin cancers, diagnosed every year. That type of cancer begins in the basal cell of the epidermis, which is the top layer of our skin. And as with other forms of skin cancer, it's related to ultraviolet exposure, sun damage. That sun damage goes to the cells of that layer and damages the DNA. Basal cell skin cancer often looks like a small, flesh-colored, waxy little bump. And another word to describe it is pearly. They often look like little pearls. They can look different than that, though that's one of the more common manifestations.
And what about the second type of skin cancer that you talked about?
The second most common type of skin cancer is squamous cell carcinoma. That is also caused by sun exposure most often, though not always. It can also occur not just on sun-exposed areas, but also on areas not exposed, such as the mouth or genital tract. That one, it has a variety of appearances to it when it starts, but really pay attention to non-healing, red, scaly, rough, ulcerated, bleeding, tender, sometimes just white patches, anything that looks different. Squamous cell has a variety of appearances, but look for red, scaly spots. And
then lastly, melanomas. What are melanomas? And are they different from the first 2 that you talked about?
Yes, melanoma is, it only accounts for 5% of all skin cancers. However, it's the riskiest kind. It's the deadliest form. It accounts for most of the skin cancer-related deaths in the United States. So it's the most important one to talk about, I think, today. It's a cancer that arises in the skin, of course, in the epidermis, and the melanocytes are the types of cells in your skin that create melanin. That's the pigment in your skin. That's where the melanoma arises.
Like the other 2 forms of skin cancer, are melanomas also caused by UV radiation?
Yes, absolutely. Over the years, we have more and more evidence that they are definitely related to ultraviolet radiation, both sun, out of doors, and indoors with tanning bed exposure. And this is really key because here's an astounding statistic. 1 person in the United States dies of melanoma every hour. Very important to pay attention to. So yes, ultraviolet radiation is an important factor. We also have to think about other factors with melanoma. It is more complex. There are other pathways involved. Genetics is also a very important factor, family history. And the type of skin you have, the more fair, light skin, more likely to burn, freckles, that type of skin is definitely more risky, more of a risk factor for melanoma.
Are skin cancers more prevalent in older generations, or can young people also get skin cancer?
Very good question. It's more likely the older you get. However, the incidence in younger adults, including adolescents, it's increasing. And we think that's most likely due to the ultraviolet exposure that people are getting, especially the teens. The most common cancer of young adults, age 25 to 29, and second most common type of cancer in age 15 to 29.
You mentioned sunburns. I think everyone in their lifetime at some point is going to get sunburned. Are you at more risk for skin cancer the more you get sunburned?
Absolutely. I think that's the most important thing to talk about today. Sunburns are very risky. We know that if you have 5 or more sunburns in your lifetime, that more than doubles your risk. If you have a sunburn in childhood or adolescence, just in that period, that also, just one will double your risk as well. So very important to prevent sunburns, especially in your children.
Well, let's switch gears here a little bit and talk about moles, because a lot of people probably associate skin cancer with moles. Is that the case?
Not always. Melanoma can and does often arise from a mole or from around a mole, but it can also start on normal skin as well.
So what's the difference between a normal mole and a melanoma?
Normal moles are very common. It's normal to have 10 to even 45 moles. That's very normal. The big thing with moles is they look uniform. They have just one color generally, maybe two, but they look nice and uniform. Nice sharp edges. They're small. They're less than a pencil eraser in size, and generally a symmetric appearance to them.
So what is an unusual looking mole?
An unusual mole, we go by the ABCDEs of moles and melanoma, for melanoma. Asymmetry, so if it's different on either side, that's something to pay attention to. B is border, scalloped, irregular, notched borders, that's more concerning. C is color. If there are multiple colors in a mole, so if you look at it and see a dark brown and a light brown, possibly a gray, blue, or red, that's more concerning. To have multiple colors, or a really dark color is more concerning as well. And then, of course, any colors that are changing is the other part of C. D is diameter. If it's bigger than a pencil eraser, that's something to pay attention to. And then E is evolving, things that are changing over time.
Are there other signs of irregularity when it comes to moles besides the ABCDE?
Yeah, one of my favorite things to talk about with patients is the ugly duckling sign. It's just an easy thing to remember. If you look at your body and you see something that just doesn't look like the rest of your moles, that's a really important thing to pay attention to. It's important to tell your friends, your spouse, help them look for that ugly duckling sign.
So are all melanomas, are they easy to spot and on the areas of your skin that's exposed to the sun?
Great question. Generally, melanomas are on sun-exposed areas of the body. Again, going back to the sunburn and getting that intense, occasional sun exposure is more risky for melanoma. So face, neck, back, backs of legs for women, for example. However, melanomas can occur anywhere, so it's important to look at other parts of your body, such as mouth. Have your eye doctor look at the back of your eyes. Pay attention to changes under your nails. Have your doctor at your routine physical get a good head-to-toe look.
Well, you talked about exposure to UV radiation as being a primary risk factor for melanomas. Are there some other risk factors as well besides just exposure to the sun?
In addition to that, genetics plays a large role. So if you have a family history of melanoma, make sure you have a good skin check at least once a year, more if you have a lot of moles or atypical moles. The other thing that plays a role, again, the type of skin you have, the lighter skin, more fair skin, freckles, that also plays a role. If you have a suppressed immune system, if you're on medication that would suppress your immune system, for example, you have to watch your skin even more carefully in that situation. The more moles you have, the more you have to pay attention as well. Sunburns, as we mentioned, and then folks that live closer to the equator are definitely more of a risk of sunburn as they have more intense ultraviolet exposure, but you can get melanoma anywhere. In fact, Minnesota has the 4th highest incidence of melanoma in the United States.
Wow. Well, what about tanning lamps? You know, a lot of people may think if I'm tanning indoors, if I'm in a tanning bed or tanning salon, I'm not out on the beach laying in the sun, that I'm not harming my skin because I'm not getting the sun's rays. But that's not true, right?
We know that the incidence of melanoma when you've used a tanning bed is much higher. If you've just used it one time in your life, that increases your risk by 20%. That's huge. Each time you use a tanning salon, on top of that, it increases another 2%. Another very important statistic with that, if you use the tanning salon under the age of 35, that increases your risk of melanoma by 75%. That's huge.
So what should a person do if they notice something unusual with their skin or perhaps with a mole? What should they do?
See your primary care provider and have them take a good close look. A lot of times it'll be reassuring, but it may lead to a biopsy, which is okay. That's taking a little piece of the skin and then looking under the microscope to see if it is cancer.
And if it is cancer, so what's next? What's the next step?
It's different for different types of skin cancer, but generally excision or a minor surgical procedure to remove the skin cancer is all you need, especially for squamous cell and basal cell. There are a few other options for those as well. For melanoma, this is really important. Detecting it early is key because in that situation, if it's early, a thin melanoma, a surgical procedure to remove the melanoma is usually all you need. It gets more tricky when the melanoma has spread. Then we look at other treatments, including chemotherapy with more biologic therapies or targeted therapies.
What are some things people can do to prevent skin cancer?
Pay attention to those ultraviolet rays, both indoors and outdoors, of course. Wear your sunscreen. I think an easy thing for folks is just to put a sunscreen on every day. I like to tell my patients, even in January here in Minnesota, put a good face lotion that has an SPF 15 or higher every morning. Get your face, neck, chest, back of your hands. Beyond that, if you're out of doors, you want to make sure that you're using your SPF 30 or higher and reapplying every 2 hours. The most intense sun is between 10 a.m. and 4 p.m., so if you can avoid those hours, that's ideal. So I try to tell my golfers to try to get the morning tea time, for example. But of course, they still need sunscreen even in the morning. When you're using your sunscreen, you want to make sure you apply it liberally. So a lot of people do not quite use enough. You want to use about a golf ball size amount on your whole body. Here's a really, I think, important fact for how much sunscreen you should use. Let's say you have a family of 4 and you're going on a beach vacation. Your family should, in 2 days, use 1 bottle of sunscreen. Most families just use 1.5 bottles a year.
I've heard of broad spectrum sunscreen. What is that, and is that something you should be using?
Absolutely it is, yeah, and that's a new regulation from the FDA over the past 2 years now. We used to have just SPF, as we all know about, and again, 15 at least is important for SPF. Now we look at broad spectrum, and that helps cover all of the rays, so the UVA plus the UVB, which are both known to cause skin cancer.
So Dr. Dixon, what about clothing? Is there certain clothing you should wear to protect yourself from the sun?
Yep. In addition to sunscreen, protecting with clothing is very important. Wide brim hats. A lot of people have baseball hats or visors. Doesn't quite cut it. You want to protect the back of your neck and more broad coverage with a wide brim hat. There's some good ones in local sports shops or online you can purchase.
I will have to say I'm the biggest culprit when it comes to that. I wear a baseball cap all the time in the summer, and the ears, it's really rough on the ears and the back of the neck like you talked about. So.
Very good point. We do see a lot of skin cancers on the tops of ears in men. In addition to wide brim hats, sunglasses are very important all year round. UV radiation can cause cataracts, for example. So wearing your sunglasses is very important. Long sleeve clothing when you're out in the garden or doing your yard work, as much as you can. Wear your long sleeve shirts. Helps protect from the sun.
Well, unfortunately, we're all out of time, but a great topic for these summer months as we begin summer. I'd like to thank our guest today, Dr. Melanie Dixon, for joining us today on Speaking of Health. Thank you.
Absolutely, my pleasure.
Have a great day, everyone, and be healthy.